Disruptive Mood Dysregulation Disorder, often grouped under depressive disorders in psychiatric classification systems, represents one of the most challenging and misunderstood conditions affecting children and adolescents today. This relatively new diagnostic category was introduced in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, as a response to growing concerns about the overdiagnosis of bipolar disorder in young people. The condition is characterized by severe recurrent temper outbursts that are grossly out of proportion to the situation, occurring alongside persistent irritability or angry mood between episodes. The development of DMDD as a distinct diagnostic entity emerged from extensive research indicating that many children previously diagnosed with pediatric bipolar disorder were actually experiencing a different pattern of mood dysregulation. Unlike bipolar disorder, which involves distinct episodes of mania or hypomania alternating with depression, DMDD is characterized by chronic, severe irritability without the episodic nature typical of bipolar conditions. This distinction has profound implications for treatment approaches and long-term prognosis, as children with DMDD are more likely to develop unipolar depression or anxiety disorders in adulthood rather than bipolar disorder. The clinical presentation of DMDD is both distinctive and debilitating. Children with this condition experience severe temper outbursts that occur on average 3 or more times per week, with these episodes being grossly disproportionate to the precipitating factor. Between these explosive episodes, the child's mood remains persistently irritable, angry, or sad for most of the day, nearly every day. This chronic irritability is observable by others, including parents, teachers, and peers, creating significant impairment in multiple settings including home, school, and social environments. The neurobiological underpinnings of DMDD involve complex interactions between genetic predisposition, brain development, and environmental factors. Neuroimaging studies have revealed differences in brain regions associated with emotional regulation, including the prefrontal cortex, amygdala, and anterior cingulate cortex. These structural and functional differences may contribute to the difficulty children with DMDD experience in managing intense emotions and regulating their behavioral responses to frustration or disappointment. Diagnosing DMDD requires careful assessment and consideration of multiple factors. The onset of symptoms must occur before age 10, and the diagnosis cannot be made before age 6 or after age 18. The condition must be present for at least 12 months, without a period of 3 or more consecutive months during which criteria are not met. Additionally, the symptoms must cause significant impairment in functioning and cannot be better explained by other psychiatric conditions, substance use, or medical conditions. The differential diagnosis of DMDD can be particularly challenging, as symptoms may overlap with other childhood psychiatric conditions. Attention deficit/hyperactivity disorder, oppositional defiant disorder, autism spectrum disorders, and anxiety disorders all share certain features with DMDD. However, the severity and chronicity of mood symptoms in DMDD distinguish it from these other conditions. The persistent irritability and severe temper outbursts in DMDD are more intense and impairing than the behavioral difficulties seen in oppositional defiant disorder. Treatment approaches for DMDD typically involve a multimodal strategy combining psychotherapy, family interventions, and sometimes medication. Cognitive behavioral therapy adapted for children focuses on teaching emotional regulation skills, problem-solving techniques, and coping strategies for managing intense emotions. Parent training programs help families develop consistent, supportive responses to challenging behaviors while maintaining appropriate boundaries and expectations. Pharmacological interventions for DMDD are still being researched, as the condition is relatively new to psychiatric classification. Some studies suggest that certain antidepressants, particularly selective serotonin reuptake inhibitors, may help with the underlying mood symptoms. Mood stabilizers and atypical antipsychotics have also been explored, though their use requires careful consideration of potential side effects and limited evidence base in this specific population. The prognosis for children with DMDD varies significantly depending on early intervention, family support, and individual factors. While some children experience improvement with appropriate treatment, others may continue to struggle with emotional regulation difficulties into adolescence and adulthood. Longitudinal studies suggest that children with DMDD are at increased risk for developing major depressive disorder, anxiety disorders, and other mood-related conditions later in life. School-based interventions play a crucial role in supporting children with DMDD, as academic environments can be particularly challenging for these young people. Accommodations may include modified expectations during periods of emotional distress, access to quiet spaces for regulation, and collaboration between mental health professionals and educational staff to ensure consistent approaches across settings. The impact of DMDD extends beyond the affected child to encompass the entire family system. Parents often experience significant stress, guilt, and confusion about how to respond to their child's intense emotional episodes. Siblings may feel overlooked or frightened by the disruptive behaviors, requiring additional support and understanding. Family therapy can address these dynamics while strengthening the overall family's capacity to support the child with DMDD. Research into DMDD continues to evolve, with ongoing studies examining its relationship to other psychiatric conditions, optimal treatment approaches, and long-term outcomes. The inclusion of DMDD in the depressive disorders category reflects current understanding of its connection to mood regulation difficulties, though some researchers debate whether it might be better classified as a separate category of emotional dysregulation disorders. Understanding DMDD requires recognition of the complex interplay between biological vulnerability, developmental factors, and environmental influences. This comprehensive perspective enables more effective intervention strategies that address not only the immediate symptoms, but also the underlying emotional regulation difficulties that characterize this challenging condition. As research continues to advance our understanding of DMDD, treatment approaches will likely become more refined and effective, offering hope for improved outcomes for children and families affected by this condition.